Good morning, everybody. You go ahead and get started just in another minute or two. Good morning, everybody. Again, thank you for joining us. We're going to this meeting today. We're going to talk a little bit about the understanding the benefit options, and this is a just kind of a high overview to understand the basics here and understand the need, and also some strategies on how to help your benefit plan and making sure that you have the right strategy to go forward in 2017 and beyond. To start, wanted to go ahead and talk a little bit about the responsibilities for employers, and here we're going to go ahead and talk a little bit about penalties. This is for large employers, those who have at least 50 or more full-time equivalent employees, and for those employees. For those employers, I should say, there's two different penalties that we want to outline. There's a penalty A, as we discussed, and that applies to large employers who do not meet the minimum. They do not have a plan that meets minimum essential coverage, or what we call MEC. And then that penalty for those employers is $2,160 per each employee after the first 30 employees. And that could definitely rack up to a pretty high number for those large employers. And the solution for that is by having some type of plan that meets the minimum essential coverage, which would be what we call a MEC plan, or a minimum value plan that has those minimum essential coverages in there. And I'll talk a little bit more about what the minimum value plan is as well in a moment. But before I do, let's go on to the next penalty, which is the penalty B, which applies to large employers, again, who have 50 or more employees, who do not offer a health plan that meets a minimum value. And a minimum value means a plan that is at least 60% of the health costs or more. And that's what you see most of all the plans that you see on the healthcare.gov, for example. Those plans include hospital coverage and prescription coverage and so forth. And that also this plan needs to meet affordability, which comes out to 9.66% of the employee income or less that they would have to pay for the plan. And so again, the plan the way to avoid the penalty B is by offering a health plan that meets minimum value and meets affordability requirements. And that penalty comes out to $3,240 per each employee that goes onto the exchange and receives a subsidy. And the solution for that is a MVP plan, or a plan that meets a minimum value. And so with that, it's a pretty simple strategy. By offering a MEC plan, or a plan that meets minimum essential coverage, and a plan that meets minimum value, or MVP plan, you're able to avoid both the different penalties for large employers, and of course be able to offer the benefits that the employees need. So that's the large employer penalties, and then there's a small employers penalties, which there are none. And so for those who have small businesses or work with small businesses, there's not a penalty for not offering benefits if you have less than 50 employees, at least on the employer level. And kind of going into the next slide here, there's something that employers need to be able to do, and that is to offer basically unbiased benefits to their employees. So, for example, you'll see that there's a class of employees that could be offered to. For example, the management class employees need to be offered the same benefits as all the other management class business employees. And then and another example, working class or worker class needs to be offered the same benefits as all the other worker class employees. And that way it's all fair and equal, and of course meets the requirements that are out there for the IRS, for example, for the Section 125 or other requirements to make sure that there's no discrimination as well. So that's kind of outlines those employer taxes, but we would be, of course, amiss to not mention the employee taxes. There's also a tax for employees by not having coverage, and this is, of course, for any individual person, and we also call this the individual mandate as outlined by the Affordable Health Care Act. And you'll see this is actually a clip just from the healthcare.gov website, so it's pretty straightforward. You'll see there's a penalty for employees or for people who do not have healthcare plans, and this would be a plan that meets minimum value or minimum essential coverage. And there's a penalty of 2.5% of their income or a flat amount, whichever is higher. And that flat amount would be $695 per adult or $347.50 per child. And I have a next slide here. I did a real quick calculation on the website, and for a lot of the employers especially, but there's many people who kind of fits the same criteria here. And in this example, I went for 2017, and I also used a person who had an income of $100,000. And with that, there would be a penalty of $2,085 if you do not offer health coverage for this example that I put in the system here. And that's, of course, the amount that's set because of the bronze level premium for 2017, the average bronze level premium. So that kind of shows you the need for some type of coverage in place. If you do nothing, there's of course a tax penalty there, and if you do something, we could of course help you help the employer, help whoever is getting this plan, the employees, be able to save tax penalties and make sure that they're in compliance going forward in 2017. So with that being said, I kind of wanted to talk a little bit about what some of these plans mean. Minimum essential coverage plan is a plan that basically has the coverages that are outlined by healthcare.gov and or by the healthcare laws, and those are just preventative and wellness benefits. And those benefits kind of go over some of those. Those would be benefits such as an annual checkup or screenings for cancer or other diseases that are preventable, and so those are kind of all that's required in minimum essential or the minimum essential coverage, and those are preventive and wellness. It's really, there's just a limitation or a limited number of benefits there, and there's not a lot of coverages there, and that's important to note. But by having those coverages, you're avoiding the penalty for having those coverages in place. And kind of going into the next plan, that's the MVP, or a plan that meets minimum value. And that is a plan that, if you were going on the exchange, would have a bronze level or better. And there's a lot of different plans out there. Any plan that has bronze level or better, so that's 60% of actuarial value. That's in complicated terms, but in effect, if you have a plan that has the hospital coverage and has the coverages that are pretty typical in plans nowadays, then that would be a plan that meets minimum value. And of course, for those large employers, they need to meet the affordability guidelines. That's at 9.66% in 2016 and going forward. One of the things that I wanted to kind of express here, and this is something that I feel is important when you're looking at helping employers or helping individuals manage their healthcare risk, and I do that by discussing the layers of protection with the employees or the employers or whomever we're working with. And as you kind of see from this diagram, there's different levels. And by having these different plans, you might be able to protect some of those different levels. And so, as you see in the bottom of the diagram there's a preventive and wellness coverages, and that's able to be met by having some type of plan that has minimum essential coverage or a minimum value plan, of course. But by having that minimum essential coverage, you're able to take care of that bare need, and then having other coverages in place that would help take care of those other needs. And so the catastrophic coverage, that's one that everyone's worried about for some things that may happen. Of course, some of the bigger things that happen are things such as heart attack, stroke, cancer, and those things happen. Those are the three major causes of healthcare problems for those who are healthy. And when you have some type of coverage in place that protects the individual for that, then of course that goes a long way. And so having different plans that will help coordinate these risk layers will help the employee. And so you could do that through having some type of plan that meets minimum value, such as a regular bronze plan or silver plan, for example. Or if you're an individual, you might get something such as a short-term medical plan, which you could opt into. And so if you were to offer this minimum essential coverage plan, for example, to all your employees, the employees could either opt to buy a minimum value plan as an upgrade, and they could pay additional premiums to help cover those costs, or they could buy a short-term medical plan, or something that will help cover that risk. And you'll see here there's also a discussion about the out-of-pocket costs that employees have or individuals have when it comes to healthcare. And so they could help fill that gap by having some type of indemnity plan, like a hospital plan, cancer plan, or a critical illness plan. And that will help cover the out-of-pocket costs that arise when these different health events take place. And so by having the strategy in place, you're able to help the individuals, the employers, by being able to have the different coverages that they need to be able to be, of course, not only compliant and avoid a tax penalty, but of course having the coverages that will take care of their different needs. Going into a next example here, or the slide here, there's an example of a large employer. In this example, I used something very, very simple, which is 100 group employees, and I used a mix of 80 employees on a minimum essential coverage plan, or a MEC plan, and 20 employees on a minimum value plan. And in this case, I just made it pretty simple by saying there's no dependents, that we're going to talk about that right now. And you'll see there's the PLANSTINA MEC plan, and starts at $30 per employee, and we're going to put 80 employees on that. And a minimum value plan, I'm just going to use that in generic terms, and we'll say that the employer is paying $200 for each plan, and there's 20 of those employees. And so by looking at this strategy, you have a benefit plan that's $6,400 for all 100 employees by using this strategy, which gives you an average cost of $64 per employee for all 100 employees. And this strategy is something that we were able to see happen and work for many employers because they're able to not only give them the benefits that they need, because a lot of employees will be perfectly happy with the MEC plan, with be able to buy up into additional plans if they like to, and it fits their needs. But also the employees that need a little bit more coverage, or like to have a little bit more coverage, are able to opt up and purchase those plans. And of course, keeping the cost low for the employer. $64 is much less than those potential penalties would be for not having coverage for your employees at the large employer level. So that's just one quick example. And kind of going into a small employer example, I have one employee with a child and spouse, so a normal family perhaps. And with this family plan, that's an $80 plan. And in this example, we have a short-term medical plan, and we're going to put a hospital plan, critical illness coverage, life insurance coverage, disability coverage, dental vision coverage, and this whole total package is $560, which is much less than if you were to buy just a catastrophic health plan on the exchange and pay the full price of the premium. Those premiums are usually towards $800 or more for a family, And when you're looking at this strategy, you could certainly have the coverages that you need to help protect those different layers of protection, and of course some extra coverages that that you normally wouldn't be able to afford if you were to pay $100 or more for your plan. And this would give you all the different benefits that you might need or want to make sure that your family's protected. So we're able to save employers and small groups a lot of money by implementing some type of strategy like this. And of course, if depending on the budget of an employee, you might see that they just come, or the employer, if it's really tight, for example, we could bring it down to the $80 if needs be, or whatever customized package you want to put together for the employer, for yourself. So that was kind of a high overview, and I wanted to make sure we kept this conversation pretty, or the slides pretty short, so we can answer any questions and have a discussion here at the end. So I'd like to open it up and see if there's any questions or thoughts on any of this that we might be able to address and help you out with. But also point out some of the contact information if you do have any questions later on, or if you'd like any help, or if we could do anything to help you guys save some money on your health care, and of course all the different people that you might work with. Any questions at this time? It's a quiet group today. Is everyone still there?
Can you hear me, Nathan?
Yes, I can hear you.
Okay, this is me. So on the MEC plan, so basically if the individual go to the hospital and let's say they didn't buy any, indemnity plan to go with it, or short-term medical, would the hospital recognize that this person's, the reason why they're under this plan because they're in a hardship, they just got the minimum requirement, would they give them the discount based on cash patient?
Yeah, that's a great question. So in other words, if you're going into the hospital or having some other type of emergency care that's not covered on the minimum essential coverage, would they give the employee or the person who's covered in this plan a discount for not having the coverage? And I guess I'd have to answer that in one way, and that is generically, and I'd say yes. That's typically the case. They look at the employee as a cash pay, or most of these plans that we provide have some type of network. And so if they have a network, they would have either a reduced cost for having a plan in place at least, but then also if you have by having some type of plan, you're able to work out different financial arrangements with the hospital or provider. But that of course is going to be something that's more of a one-off, or a agreement between that employee and the provider. And so to kind of answer that, I say it generically, yes, it's typically the case, but that of course will vary from situation to situation a little bit. And that's why it's important to buy an indemnity plan, or a short-term medical plan, or some type of other plan to put in place with it. But but certainly doing nothing is the worst situation, where you get a tax penalty that's more than the cost of the plan. So you save yourself a lot of money by having something in place. But if you do nothing, then of course you're getting a penalty and still stuck in that same situation as well.
Yeah, the reason I asked that is because, yesterday when I was at the enrollment, a lot of the security guards, they don't make a lot of money.
Yeah.
And unfortunately, their company don't even help them at all with the healthcare plan. So they either make too much for their Medi-Cal, and they don't make enough to buy the Obamacare. So this plan, it kind of attract them, but I expressed a concern. I was like, but you have to buy something to also cover the out-of-pocket costs, because you're going to have to pay something the hospital not going to pay 100% for you. So you're going to be responsible for the medical bill. They will give you discount, but you're still responsible for a certain portion. So, you know, why I promoted the Washington National accident with the ICU. The ICU at least give them, just in case if there's a serious sickness or injury, like an accident, car accident, they can go to ICU and they're covered. And they get pay at least $500 on the second day on sickness and illness, right? And then car accident, they double on the first day. So based on their job, they can get injured, how you say it, higher percentage than certain other job title.
Sure.
Because they're a security guard. Yeah. So, and I told them, I said, if you don't use it, at least you get return of premium, and so that attract them. So at least I got them into the accident with the ICU, at least.
Yeah. No,
just to
great.
get started, Yeah, I told them, I was like, this is like you're putting money away, saving, if you don't use it, you'll get your money back. And they're like, oh, okay, because first they're like, I can't afford this is too much, to adding on top of other, because the hospital indemnity, the wellness, the hospital secure, that's a great plan. And I try to promote that with the MEC plan, because I think that's perfect, But right now, $30 seems like is almost a lot for them already.
Yeah, no, you're absolutely right.
Yeah.
There's different varying budgets and different concerns, and that's why it's good to have multiple plans. And wanted to show you this is kind of a sneak peek. This is a different plans that we offer for different MEC plans. We have the ASO MEC plan that's for employers, and that's where the claims are paid by the employer. That's the ASO MEC plan. That's our $30 employee plan. And then there's also these other plans that we could offer as well. We have the level-funded MEC basic plan, which is basically you'll see that it starts at $65, and that's a plan that covers all the claims within that plan. That's an additional benefit there. And then you'll look at level 2 and 3. I'm sorry, the Plus plan and the Advanced plan, where it goes up a little bit more in cost, but there's additional benefits such as a primary care physician or office visit, and also prescription costs. So if you have an employee who has prescription needs and they need to have some more additional coverages, you'll see there's a specialist visits, urgent care. These are still considered MEC plans, so they're not, they don't meet the minimum value coverages, but certainly with a plan like this, you can meet a lot of the requirements of a lot of employees, and that's a lot less expensive than a full health insurance plan at $135 for an employee. So you could certainly help take care of any employee that, depending on what their needs are, with the different plans that we have here. This kind of gives you a quick. Yep.
Nathan, on this here, this information is not on the brochure, right? So
nope.
the individual who signed up will get this information when they get their medical card.
Yep, and this is kind of why I was saying this is kind of a little bit of a sneak peek, because these are some plans that are new. Before our only offering was the ASO MEC plan. That's where the claims are paid as they occur. And now you'll see there's 3 other options for employers to pick from.
Okay, what about the clients that I had submit, or the first, remember the liquor store couple?
Sure. Yeah,
can they be on this plan?
They could choose to change the plan, of course. They could opt to change it to a different MEC plan.
Okay. I think we already enrolled them on the first one that you had introduced us.
Yep. So you could.
So can we still change it?
Yeah. So if you have anybody that's enrolled in a plan, regardless, and this is a great thing about MEC plans or plans that these group plans, and this is for everybody to know, is if you have somebody that's in a plan already, they could change plans in the middle of the year or whenever they like to. Obviously, there's effective dates that they have to make sure that they keep track of, but you can help an employer change their benefits in the middle of a term or middle of a year. Not everybody has benefits that renew for January 1st or December 1st, but there's benefits that renew throughout the year. And if there's needs that change, and this is really easy for those small employers that only have themselves, for example, they could change if they're on a MEC plan, but then they get diagnosed with something serious, they could change into a regular health plan a little bit more easily when they're by themselves. But if you have a large employer that already has a MEC plan, then it might be something that is really simple to change to a different MEC plan. And so we of course have a portfolio or a suite of different MEC plans that could help varying employees get the coverage that they need, and we love to help them whenever we could bring them on. So that's a great question, B. Thanks for asking that.
Yeah, what would help us a lot if we can get a chart like this, so we can actually present it to the individual when we talk to them about the plan.
Yep.
When we enroll the benefits, so they can have options and choices. Because right now we're just talking about $30, which is the lowest. But and I did went over, the brochure with them, but this is more clear.
Yep.
The chart right here.
Yes. So this chart is coming out. So if you this is a sample proposal that we have, and we could put your company's name in for the proposal, put your broker information in there, and provide this to you could provide this to your groups or the people that you're working with to provide these different proposals to them. So get us a request for a proposal. We'll put that together for you guys, and love to help them anytime.
Thank you.
Of course. Thank you, B. Any other questions? Anybody else? All right. Well, I think our time's about up anyway, so if you have any questions, feel free to reach out to us. We'd love to help you and make sure that you get the coverages that you need for your benefit plan. Please feel free to reach out we have these different contacts here on the slide here. You can give us a call or email us, and we'd love to help you out. Again, thanks for joining us in this webinar. We have these webinars on a regular basis. You can enroll on our website, or feel free to join us and to learn more about how we can help. Thanks again, everybody. Take care.